Hello, my name is Dr. Kyle Lansdell. I'm an emergency physician at the Thunder Bay Regional Health Science Center. I'm here today to talk to you about respiratory illnesses. This time of year we have a lot of respiratory illnesses and there's a lot of frequently asked questions that we receive in our department. So hopefully today I can share some information about respiratory illnesses with you, what to expect from your ED visit, and some frequently asked questions that I can help answer for you. So all respiratory illnesses share a lot in common. The one thing is that they're all mostly viral illnesses. And unlike bacterial illnesses, viral illnesses usually do not respond to antibiotics. So often when you come to the emergency department, your physician will recommend that a course of observation is usually indicated over receiving antibiotics. The other thing that is common with respiratory illnesses is that they all share a lot of the similar symptoms. They all share things like runny nose, cough, sore throat, headaches, and chills. You can expect these symptoms to typically peak around day 3 and day 4 of the illness and improve from there. One of the keys of treating a viral illness is to treat the symptoms. Typically, we would treat the symptoms of fever with things such as Tylenol or Advil, and we would treat things like dehydration with adequate amounts of fluid. Often there is a diminished appetite during a viral illness, although this is usually not of significant concern. Some populations are at higher risk when it comes to their respiratory illnesses. The very old and the very young often have weakened immune systems, and some medical conditions have immunocompromise, which would combat their ability to fight off of an illness. If you think that you're one of these people, please come to the emergency department for further assessment. Although there are some individuals who do suffer serious medical consequences of their viral illness, the vast majority of individuals usually will return to their normal health within 4 or 5 days of their respiratory illness and do not require emergency department care or evaluations. Typically, we would treat the symptoms of fever with things such as Tylenol or Advil, and we would treat things like dehydration with adequate amounts of fluid. Signs or symptoms that may be of concern would include any increased work of breathing. Should you notice things like nasal flaring, increased tracheal tug, which is the throat going up and down, increased respiratory expansion of the lungs where your abdomen is working hard to breathe or get oxygen in, these would be signs that could be concerning and might require further evaluation by a physician. Often these symptoms are seen in the very young and the very old. If you start to notice any skin color changes around the lips or around the face that might suggest a decreased amount of oxygen to those areas, also please come to the emergency department for evaluation. We are still seeing a lot of patients presenting to the emergency department with COVID-19. Thankfully, due to a high uptake in vaccinations, the rate of severe illness has dramatically dropped. For the vast majority of patients, COVID is now presenting much like a common cold. Things like sore throat, cough, runny nose, headache, and some increased work of breathing can often be present with COVID. The vast majority of these patients will improve with time, with the symptoms typically peaking around 5 to 7 days. Often, there is very little that is needed to address these symptoms. However, there are some patients that do benefit from medical care. Individuals who are of extremes of age, the very old or the very young, or those who have underlying medical conditions that compromise their immune system may require the emergency department's assistance in their medical care. Should you feel that you are one of these individuals, I would encourage you to come and have an assessment done. If you feel that you have acquired COVID, the best thing that you can do in the initial phase is to stay home. Avoid contact with other people that might have COVID. Frequently wash your hands. Try to distance yourself from others who are not sick. When you do need to go out into the community, a mask is advisable to be worn. Treat your symptoms of fever with things like Tylenol or Advil. Treat dehydration with things like fluid. Over-the-counter cough remedies can be tried, but please consult your pharmacist. If you're having increased work of breathing or you're having a fever that's persisting beyond 5 days, an emergency department assessment would be appropriate. RSV stands for Respiratory Syncytial virus. It's a very common upper respiratory tract infection in both children and adults. We tend to see this being mostly a disease of the very young. Ages under 6 are very prone to RSV, especially through school contacts. Typically, RSV will peak around day 4 and day 5 and can include symptoms such as fever, cough, runny nose, sore throat, and loss of appetite. If you or your child are believed to have RSV, look for things like increased work of breathing. If your child's having difficulty breathing, difficulty holding down fluids, diminished wet diapers, or fever that's persistent beyond 5 days, all of these symptoms would be appropriate to be assessed by the emergency department. With symptoms peaking around day 4, day 5, typically if you are beyond day 4 or day 5, you can take comfort in the fact that often symptoms are not going to get any worse at that point and should only improve. However, early on in the illness, if there are some struggles to breathe, it's appropriate to be assessed by a medical practitioner. If you believe that your child has had RSV, focus on things like the nasal congestion. Often the nasal congestion and the mucus will worsen and obstruct their airways and can be improved with things like the nasal suction aspirators and the cool mist bedside vaporizers. Things like Tylenol at appropriate doses can assist with fever, and often cool air can soothe the airway. However, if you feel that your child is having an increased work of breathing despite these measures, an appropriate medical assessment is indicated. When it comes to respiratory illnesses that are typically viral, the best thing to do is to try to prevent them in the first place. These would include common things like hand washing, social distancing, and masking when appropriate. If you think that you have a respiratory illness, try to stay home and avoid work and exposing other people to that illness. Ensure that you are up to date with your COVID vaccinations as well as your influenza vaccinations and your childhood vaccinations for your children. This time of year, respiratory illnesses are quite common. We're seeing an influx of things like COVID, RSV, and influenza all presenting to the emergency department. They all share very similar symptoms. However, most of them do improve on their own at home with things like Tylenol fluids and mostly time. However, there are some people that do require medical care, and the Thunder Bay Regional Health Sciences Center is here to provide excellent care for every patient should you feel that you're in need of care.